Yeah.
So on number 2, ask your status. Who is reasonable in the hospital who can give you accurate information about your status? Should we expect that nurses would know that? Or do we have to go to our case manager? Do we have to go to the billing department? Where do we go to find out the true answer?
Yeah, don't go to the billing department, all right? Because they're not going to know, and they're not going to even get a bill until it's all, you've left the hospital. But the nurse can tell you, okay? The nurse should tell you. So are you an in or out? They should be able to tell you. If not, ask the case manager. Because, listen, here's the thing. Right now, we're sitting here, no doubt. There's at least 4, 5, 6 cases at each facility going through that process. Is this out? Is this in? What's the doctor found out? What are we? It's very fluid. Did the labs come back? Yes, it did. Is the doctor going to run it? No, the doctor doesn't think there's anything else. This looks completely outpatient. So it's pretty fluid. But if it changes, you got to be notified.
So just as a follow-up there, I think some family members are in the room who have gone to the nurses and asked and have not gotten very good answers.
Then you got to go here. You got to go here.
Is the case manager there around the clock or just 9 to 5?
Yeah, they're pretty much 9 to 5. Pretty much 9
Are
to
they
5.
all educated now to know to do that? Because they weren't when I was there
Yeah.
a year and a half ago. I mean, they didn't even know what observation meant.
Yeah, who's that? The nurses and the yeah.
And the case manager.
Yeah.
They said,
If the yes, pardon me.
but you know, that was a year and a half ago. I mean,
Right.
there was just
Yep.
no education, and they
Well-
didn't even know where to look for it.
Well, it's always in your record. So okay, so I'm just telling you guys. So if you run across a nurse, let's say you get up there and the nurse, you say, well, I want to know if I'm inpatient or outpatient. You would not be in the facility without being placed as an inpatient. You wouldn't be in a bed without being observation or inpatient. So it's on your chart. So you say, Mary, go look on my chart. I know you may be a new nurse, but if you go look at the
It took me 4 days to get the information.
well, that's sad.
I asked every
Sad,
single
yeah.
day.
And can I just follow up? What does that look like on the chart to help our nurses?
Good question. It will say
Physician order is
it's a physician order. So to put you in a bed, you got to have a level of care. It's like the doctor has to write a level of care, right? All these are required by Medicare. So what are we going to do? So let's just take that. It's a great question. So let's take that. You're in the ER. So what are we going to do? We go back to chest pain. Observation. The doctor will write an order that said place in observation services. Right now it'll probably also say expect the patient to be here less than 2 midnights or 48 hours. It's something Medicare requires. So the doctor's saying we got chest pain. I really am not sure that it's an MI. I don't think so, but I'm going to figure it out. Probably going to be here less than 2 days observation. So that order will be on the chart. That's how you get upstairs to bed. Or having a heart attack, inpatient, and we'll say admit to inpatient services. Think the patient will be here more than 2 midnights. That's a requirement by Medicare right now. But the physicians say more than 2 midnights or less than 2 midnights. That's the Medicare 48-hour issue. So they make the physician say, hey, take a guess, you know, by looking at what's wrong with them.
Can you be inpatient for under 48 hours?
Sure. Yeah. Yeah.
With all this being said, if you have a supplemental insurance, then inpatient, observation, outpatient, none of that really matters. Except for, obviously, when you're getting physical therapy as under Part A or Part B. But other than that, your services, your billing, everything is taken care of when you got the supplemental in place, right?
Pretty much. But you make sure you check your supplement. I mean, there's hundreds and hundreds of supplements. So just make sure your supplements cover, you know what I'm saying?
Yeah.
But typically, yes.
So you did differentiate between straight Medicare and what?
Advantage plan?
Advantage plan.
Like, what-
Because the Advantage Medicare may not cover what straight Medicare, so I thought you distinguished straight Medicare and good supplement.
No, we didn't really talk about either one of those.
Okay.
That doesn't make a difference now, because when you're on an Advantage plan, you've got a different plan. You've got now a Humana or a Blue Cross or somebody else delivering your Medicare benefit, right? So you've got different copays, you've got different cost shares, so you got to know your plan, okay? But whether you're an inpatient or outpatient, not based on your insurance. It's based on your medical condition, right? And then your payer, well, you may not have a 20% copay for observation services if you have a certain Blue Cross Advantage plan, or you may have a 25%, or you have a 15%. You got to know your plan.
When did all this happen? Why?
Oh, I will tell you. Here, that's a great question. These rules, these guidelines by Medicare have been there for more than a decade. Okay? The problem is around 2010, 2011, because of the budget crunch in the federal government, did Medicare start making folks do what they're supposed to be doing. And here you go. So they said, wait a minute. You hear it every day. You'll just every week you're going to hear something. Medicare's budget's going to be 25% of GDP and whatever. 10,000 people a day are hitting the Medicare rolls. So it's just like the Social Security. The government knows we can't continue at this pace. So you will see, and you've had a lot in the Central Florida, fraud. There was one just paper the other day where they knocked on the guy's door and he went to the door. The doc did in his T-shirt and his shorts. $38 million worth of fraud. They're going after people for not following the guidelines. Guidelines really haven't changed. Guidelines have not changed. Medicare is just saying, look, now we really got to get serious about this stuff, okay? And we got to do it right, and we're not going to pay for it. What else has come from that? And let's just get to this. Let's get to the SNF piece. What else has come of that? Medicare started cracking down on the SNF payments. 5 years ago, you went to the SNF, they paid for it. Now they're like, wait a minute. We're wasting money. We're not paying for SNF care if it doesn't have a qualifying hospital stay. That's really what's got the Brian Williams going and the patients upset and everything going on. Those rules have been there more than a decade. Medicare's just now tightening up on things. And they're going to continue to be tight. Right? We're in the good times. This is going to get rougher and rougher. Right? And if you've been in it, you've seen it. I mean, we didn't have this problem 6-7 years ago. We didn't get no denials. When I walked through the door over here in February, I had 4 waiting on my desk. The highest one was about an $18,000 bill from a lady who didn't have a qualifying stay and went to the SNF. Now, NCH covered those bills, but you don't see you see the horror stories on TV. Yeah.
Medicare is a usually complex plan, and a lot of people don't really understand it, but they go with the flow. You do this, you do this, you do that.
Right.
Would you caution people not to go after those, the Advantage plans, the Humana, because I think, I was in the insurance business for like 20 years. It's really, and Humana had a lot of issues, but I don't know if they're like that today. So I can't say if they're a better company maybe, and they pay better, but the government plan, it's all about money, isn't it?
Right.
Yeah, so in other words, if you go to a different plan, it's going to cost you less money, so you think.
Right.
And then you get a claim, and then all of a sudden someone says to you, hey, you're out of luck. You didn't read the fine print. We don't pay for that. Had you kept your Medicare plan, guess what? You'd have it, but you would be more, you'd be more money out of pocket. But in the end, you would have been better off, I would think.
Yep. Is anybody in here selling Advantage plans? It really depends on your cost. I think when you look at that, you have to look at how much is it going to cost. do they, some of these Advantage plans bundle them together and they bundle in your A, B, and your D. You get your part prescription benefit. If you could afford it, if I was purchasing it, I would have my straight traditional Medicare and a supplement. That's just me. I don't know, and please don't go out and say, oh, because I'll get some, believe me, whew, they'll come after me over here.
And the reason for that is you don't know what the future holds. You might buy the plan today, and you don't know if some horrible thing comes in your life, and now you say, oh, darn it, I should have had Medicare, because now I'm in trouble.
Right. But when you when you give Humana a little more money to manage your benefit, how do you think they make money?
They don't pay you. That's how they all.
Managing the benefit, right? Managing the benefit.
That's
So,
the game. That's the insurance game.
so, but you may not be, you gotta, if you can afford it, you can do it, keep up with it. You have to keep up with it yearly. It's a lot cheaper for some things. So up front, you may be doing pretty good with your doctor's visits and your wellness visits. But when it comes to going to rehab, you may get hosed. So you have to think about what you're getting. Your insurance is your insurance, right? You need to look at what it covers because it's insurance.
Let's say one thing, that several family members have gotten into Medicaid Advantage programs not realizing that it wasn't government Medicaid, the original Medicare. So make sure you know if you're straight Medicare or an Advantage. You need to know that.
Yeah, I mean, with some stories, because now every Advantage plan is supposed to, they can give you more than your basic Medicare plan, but they're not supposed to give you less. Several large ones, you just can't convince them. So I can take you, let's say if you have traditional Medicare, and you may have whatever, commercial plan, Advantage plan, whatever. I know I can get you a lot more therapy just right off the bat because of your plan than you're going to get. I may not even get you in some places.
I had Advantage, and when you're healthy, it's great. If you're not, they're
Right.
okay.
So you need to think about what you might need. Would you ever need rehabilitation? Would you ever need some care like that? Because it can go a long way. I'm not promoting or not promoting either way or the other. I'm just telling you.